we have a keynote which will be presented by Mr. Dilip Mansuli, who is the Executive Director, India SHPL Siemens Healthineers. Later on, he would also be joined for a very interesting panel discussion, and the discussion would be around significance of technology intervention in clinical space for an early and accurate diagnosis. Dilip would be joined by Mr. Chandra Moli, who is the Chief Information and Technology Officer at Sankara Netralaya. People from Bengaluru would be definitely familiar with this name. And they would be joined along with Dr. Sugandhi, who's an interventional cardiologist, founder director, Carditech Medical Devices. So over to you, Dilip.
Good afternoon. It's a very interesting times that we are living today. COVID has actually transformed healthcare in a big way. Digital is taking over in terms of a lot of transformational changes, which are bringing efficiency, which are bringing connectivity, which are bringing some bit of affordability and a new way of looking at health of human beings. Now, we all are so focused on how this is going to really impact industry, how it will impact a clinician, how it will impact a radiologist, or how it will impact a hospital network. But have we ever thought about how this impacts a consumer or a patient? What is his point of view, and how do we need to really address it? And today we are going to talk a little bit around that. And I'm going to be later joined by two of the experts in the field of healthcare. I will have a very interesting conversation. But I want to put a little bit of grounding of the facts as to how things are moving. In 1978, in Alma-Ata, there was a declaration that was made that every government, every NGO, every industry will focus on creating health for all by year 2000. And we were expecting that by year 2000, world will be healthy world. And we are in 2021, and last 2 years have taught us that we are in not a great shape from that perspective. There's still a lot needs to be done, despite all the efforts that we have put in. And if you think about overall disease burden on the human beings, it's totally, care is disjointed. And there are heart diseases, circulatory disorders, cancers, and respiratory disorders constitute more than 80% of the total deaths that occur due to these diseases. And it's absolutely unfair. Access is totally unfair. Nearly 80% of the people do not have access. In fact, there's a saying, where you live shouldn't determine if you live. It's a very profound statement. Where you live cannot be a decision about whether you will live. And how do we make sure this is reaching everywhere? Telemedicine, which is actually taking a great progress in last few years, is definitely bringing in that kind of approach where you live is not going to be a matter of decision of if you live anymore. I think that is something which is definitely going to change. Knowledge of people is accelerating. Knowledge because of access to the news, access to the knowledge base on internet. More people are understanding their health far better. So one of the things, every company tries to do it, and Siemens Healthineers, we are definitely focused on one thing. How do you enable better outcomes at lower cost? How do you provide a better access? And this is going to be the endeavor to make a difference to the industry, to the patient, to the clinicians, to the radiologists. And we believe that strongly the transformational changes will make it possible to increase this value through industrial things changing to a lot of digital outcomes. The medicine will become more precise. When I say more precise, it is something that the technology is moving towards a point where it is becoming far more easier to detect the diseases through a combination of different domain expertise. Whether you want to call it as expertise coming from genomics or expertise coming from blood test diagnostics or image diagnostics. Together, all these things are really bringing a lot more precision in terms of understanding the disease, understanding the patient, and combined the thing will give us understanding of medicine. We believe value will shape the care delivery. Organizations will start working around patient's medical condition. There is a saying that if you want to treat a disease better, you need to know the patient even better. If you know the patient better, then treatment to that patient will be better to manage that disease. And we strongly believe that's going to happen. And because of the knowledge that people are gaining, patients will become more of a consumers. They will be able to manage their well-being. I think the movement is going to move from today's treatment of a disease to how do you make sure a person's well-being is managed. I think that's what is going to really move towards. With consumers or patients, before they get sick, they know how to manage their health. Our wearables are helping a lot in that direction. And I think digital data that is coming in different ways, whether it is through wearables, whether it is through the data coming from your food habits or your exercise habits, is all going to tell something about your health even better. In fact, I'm a big believer in the fact that a family doctor as a concept was great because of the same fact that doctors knew their patients better. And patients used to be treated well, and that used to really give understanding of what works well for that patient, what doesn't work well for that patient. And you didn't have to do any experimentation. In China, there is a very interesting concept called a family doctor is paid an annual fee. And an annual fee gets deducted by a certain amount if anyone falls sick in the family. And if another person falls sick or a person falls sick again, more money is cut. So that means if a person is healthy, the doctor gets paid full. If someone falls sick, your share of fee goes down. That means a doctor is being paid to keep someone healthy, or well-being is the outcome that one is looking for. And in fact, that is exactly where we see we will be moving towards in the world. To us, this is something that is going to be the changing world. Expanding precision medicine and transforming care delivery to really make sure patients are getting a better experience and they are able to understand their health even before something happens to them. Through digitizing is what all this can happen. And one of the things that we can talk about is we have mastered this kind of a challenge in the past. Think about it. We didn't know how to navigate from one place to another place. We always used to look at where am I and how do I get there. And if you knew I am there in Siemens Healthineers and I need to travel to Vienna, how do I travel? Today, it is possible for us to know different routes through which I can travel. And technology has made it possible. Now think about it. From where am I? If I can start thinking about how am I and what is my path to good health? Can we look at this possibility? So is it possible for us to look at understanding? For example, I'm showing myself, my heart, a digital twin of my heart. If I can understand how my heart is working, how it is behaving, and if there are any challenges, if I need to reach a level of healthiness, how can I get there? There are 2 or 3 routes through which I can do it. I can use yoga to reach there, or I can take some medication and it may take lesser time, or I can use alternate medication or a surgery that may take some other time and some other result. Is that possible for me to look at it? And that is exactly what we believe is empowering consumers to know their health and manage that. So this is where we strongly believe the innovation is all being focused around consumers. How consumer will understand this, how consumers will change it. And healthcare is one area where innovation is far more important than many other companies, many other industries, or many other sectors. And we strongly believe we are going to be moving towards a time where consumerism is where people will start driving their own decisions on health. And I'm excited to talk about this with 2 of my fellow panelists, Dr. Sugandhi Gopal and Mr. Chandramouli, who will be joining me to talk about their thoughts and their views on how consumers will drive their decisions in the future and how healthcare will become more accessible and far more impactful. Thank you. So I want to talk about, we talked initially about how consumerism is, or rather patients are becoming more empowered. And with the more patient empowerment, we are seeing a lot of change in the way healthcare is being delivered. So I want to start a few questions with Dr. Sugandhi. Dr. Sugandhi, the pandemic has created urgency to improve healthcare reach to patients. How, as a clinical experts, are you looking to create a better access at affordable cost? I want to ask this question on 2 fronts for you. One is, you are an expert, and second, you are also a kind of technologist, I would say. So how are you trying to create that?
Thank you. So you were absolutely right, Dilip, that it's the digital medicine and remote medicine that's going to solve most of the problems of access for the patient. Very often, either they are in remote places or in the villages, or just the traffic in the city doesn't allow them to reach the doctors immediately. So if we had a way of doing this digitally, and at least sifting out the emergencies and the non-emergencies, that would contribute a lot to the reduction in morbidity. So the development of whatever is going on right now was accelerated by the COVID, and I think a lot of people are accepting it now. So development is in terms of improving the gadgets or the apps that are being used, and the providing the infrastructure from the government possibly, or from the MNCs. So the infrastructure is needed for somebody to even go to the nearest place and access the treatment. So a simple device like, let's say, a patch ECG can immediately diagnose the heart attack, send them to the nearest place, provide the first aid, get them into an ambulance. So it has to be a combination of technology and a government will to do this. And this is what we are looking at. Encouraging indigenous devices or technology would be wonderful, because we don't have to keep paying for the IP from MNCs. And I think to do that, the government is already showing the will for it. They have started many things for startups, and they are encouraging the companies that are already established to move forwards and help with the digital technology. I would additionally say, if they can ease the way that we can purchase components, because right now there is no Flipkart or local companies that can provide all the electronic components, and they could do that. Compliance tests and all that has been difficult. I think if they improve these things, I think a lot more digital technology will be accessible to the doctors and to the patients. While they are doing it, I think it's very important to inform the doctors and keep them on their side, keep the doctors on par with the technology that's being developed right now, and not to have a sense of skepticism from them, because then everything will be defeated. I think these are the things that would actually move forwards whatever is going on right now in terms of health platforms, health devices and apps that are available right now to provide very easy and quick medicine.
Great thoughts, Dr. Sugandhi. In fact, I want to turn my attention to Dr. Chandramouli. Shankar Nethralaya is known as one of the pioneers in adopting digital and transformative technologies for clinical efficiency and patient impact. Can you tell us how this is improving precision healthcare, and what are some of the big changes that you have created in Shankar Nethralaya that is pioneering work?
Yeah, certainly. But for me to get into the details of what we have done, I think I just wanted to give a bigger picture view of what's happening in the eye care generally as an industry and where we are and what we're trying to achieve. I think most of us would probably know we are in the top 3 hospitals, not only in India, even across the world. So it's one of the most pioneering organizations, particularly in India. We are called as the father of ophthalmology itself. Dr. Badrinath doesn't require an introduction. His vision has really created us some world-class hospitals across 10 locations in India. And we do close to around 400,000 related patient visits, very specified to eye itself across in any year, and close to around 180 to 200,000 of them are leading into surgeries and things like that. Ironically, India is also the largest visually impaired nation across the world, actually. So there is a lot of requirement for us to adopt better ideas, better technologies, which could be homegrown to reduce the cost of care. And we have come a long way when it was done initially around 43 years to where we stand now. We have come a long way. And I can definitely provide a lot of insights from how we have utilized technology to achieve some of these results. Because we are pioneers in the adoption of electronic medical record. When the country itself was just thinking about it, I think we have already implemented it here early around 17, 18 years ago. Very proven solution where we have consistently won awards after awards for best technology implementation. It was no easy. It was just never going to be a walk on the water for us to implement something very disruptive to what we did. And when we really went ahead with the idea of technology, I think the 3 parameters that we really looked into it was definitely to improve access, so that there is a tremendous reduction in the cost. Because when we piloted a study within Shankar Nethralaya, and we really understood that patients spend 6 times more than what they spend on Shankar Nethralaya. That's the amount of costs that are being incurred. Because quality care, particularly in ophthalmology, definitely people are required to travel to get something affordable. So we recognized that and we wanted to change that paradigm. And unfortunately, it took a COVID to really accelerate the digital transformation in telemedicine. Definitely, I can definitely say we have done around 15,000 telemedicine since the start of the pandemic itself. Actually, it's close to around 14, 15 months. I think we are already touching around 15,000 telemedicines. And even if I were to take a very, very small number of around 6,000 rupees per patient saving, we're talking about close to around 9 to 10 crores for the patient community, just on telemedicine itself. And our goal is primarily to see that every follow-up visit, you can really do a telemedicine. Probably, I think that's one of our larger goals, because close to around 120,000 patient visits can probably be avoided by simply using one of the tools that we have developed, which is largely the telemedicine. So it helps to reduce the crowd. Second, it improves the quality, the cost of care. Actually, there's a significant reduction because otherwise, you end up saving up a hell lot of money, which you would not be required for you to do. Because there are a lot of areas, say like the glaucoma, then there are diabetic retinopathy, which require continuous intervention on an ongoing basis, which are seldom done but thanks to some of these things, we can come out with better techniques. That's for sure. So it improves the access and largely leading into a better quality through better data. Actually, it's just an outcome will automatically come when there is a continuous intervention that requires to be done. And improving cost is definitely one of the basic byproducts that we really look into. It is just one aspect of it. And I can go on and on because our entire focus is to really leverage the data that we have. And I can definitely say we have more than 200 terabytes of data, which we really try to deal with some sense out of it. In fact, our roadmap is based on one single principle called making information actionable. But there are multiple factors to that, actually. I can go on and on for each one of these areas, but I think each of these driving areas are deeper, using a lot of data and analytics, which helps a lot of operational efficiency and also working on the next generation of products and solutions that are required to deal with the future of patient care. I think that's what we do with the data, actually.
No, that's brilliant, Mr. Chandramouli. I think, in fact, one of the things I feel is your exercise has impacted a lot more patients in the country, and absolute congratulations on having made a significant progress there. One thing I have a follow-up question for you is there are two aspects to treating patients. One is the making it affordable and accurate. And one piece many times we tend to ignore is the experience, patient experience. When I say patient experience, it goes from the moment he enters into a hospital to the point where he exits the hospital. What is his experience, and how does that experience change over time with technology? Are you seeing any improvements that are being done through use of technology to bring in a better decision-making for consumers or patients, or the experience they gain is a much better one? Are there anything that you are doing there, or do you
absolutely, absolutely. See, the digital acceleration post-pandemic has been far too dramatic. To put it in a nutshell, what we couldn't achieve over the last 5 years, we could do it in less than 5 months post-pandemic. I think that was the kind of a personal experience I can definitely relate to in what happened during the pandemic. And of course, the crux of all this sea changes that we've been seeing is on the patient care and putting customers or the patients in the centric of what you're trying to do. And digital is one of the means which we are looking into, and we have brought in some model changes as well in terms of because we have some very unique methods of dealing with patients in terms of the care, because we have a comprehensive eye examination, for which we really take pride about whatever we have been doing. And unfortunately, because of the pandemic and the restrictions that we had in terms of travel and things like that, many of the patients couldn't really even visit our Shankar Nethralaya because of the travel restrictions and because half of them are outside the hospitals where we don't have where they are not closer to their hometowns. We are tied up through some of our smarter hospital network, which includes the likes of Titan, with whom we have a long-standing relationship. And we have extended our telemedicine through Titan, where we can walk into Titan Telestore and do a comprehensive eye examination, bring in patient delight for all these kind of follow-ups that we can try to talk about, and also brought about AI into some of those areas, particularly diabetic retinopathy, where we have been game changer. Was the world's first diabetic retinopathy algorithm, along with Google, was co-innovated from Shankar Nethralaya. So I've been running all these AI-related applications also, where you can simply take a telemedicine and also look into take a diagnostics into one of those specialized areas and take the consultation of a doctor. To give you another broader example by sheer numbers, again, India is a home to the diabetic as well. And coupled with the retinopathy issues, I think now we have a huge population which cannot be screened at all. So we have close to just around 3,000 doctors who can really talk about anything on retina. But whereas the number of patients that needs to be screened is close to around 10 crore. So it's impossible for the doctors to do any kind of a screening. Wishfully, what we wanted to do, at least within a year or so, this could be completely made available through our internet mechanisms where you can really upload an image and get your diagnostics done. I think that's the level of consumerization of technology that you can possibly come around in the days. We have already implemented as part of our electronic medical record. Right now, the AI really helps in diagnosis of when you're inside the patient and on specific networks. But I think our larger goal is to see that this could be consumerized, where screening is becoming a lot more democratic. That's what I would definitely call it. And we are progressively working on a couple of more areas here, like glaucoma and retina as well. I think those things require a lot more time. But I think digital consumerization, all these things are getting mainstream as we really talk about it.
Great. Fantastic thoughts on that. Dr. Sugandhi, India is a capital of heart diseases, right? And it's always a challenge to work on this disease without having a lot of screening facilities or understanding of patients. Now, government has launched this new digital health stack policy, which is going to help us bring a lot of data about patients to have access to many people who want to access it. How do you think this is going to really transform the healthcare in the country? Do you think we will see a big transformational change with this?
I think so, absolutely. I think it's going to revolutionize the way that we deliver medicine, revolutionize the way we store data, we collect data. And as you know, Western medicine does not work unless we have a whole lot of data which we can interpret and decide how the medicines or the gadgets or the device or the results work. So we need to look at the basic registries that are not available at all. Like, for instance, if you look at vitamin D levels, 98% of Indians are declared as vitamin D deficient. So where do we start? And this is the same with heart. So most of the patients come during an emergency, either not having an old ECG or they come, never having had an ECG. And we don't know how to interpret the ECG. And very often 10% of patients may get unnecessarily admitted. So if we had a way of electronic health records, which the patient can also have access to, and all old reports are available as soon as they come into the emergency room, I think that will change dramatically what we do for the patient. So this would help with the registries, the data, and the basic rights of the patient. So if they want the rights, there is also a bit of duties to be done, and that's one of them to bring the EHRs to emergencies. So streamlining insurance, managing accurate clinical research would become much, much easier. So we also need to discuss, with the policymakers, how we store the data, how we maintain the security of the data, and not to have data breaches. I think that's the only, part of the health stack that perhaps still needs looking at. But otherwise, it looks like they have got it brilliantly right. And I believe that this is the way to go at a national level.
Great. I think even I strongly believe that data can actually make a huge difference in actually driving that. So with that, I want to bring one question to both of you. Okay. India does not have lack of talent. India does not have lack of great clinicians. India does not have lack of great technologists. I see Dr. Sugandhi, in you as clinician and a technologist.
Yeah.
And Chandramouli, I see a great technologist who has made a huge impact. How do we accelerate? If we need to accelerate with the work between different people collaborating, how should we take this? You talked a little bit about MNCs, right? I'm a MNC. And how do we really make India a much bigger place in terms of health? When I say bigger place, I'm saying healthiness index, if it has to go up. What should we do to work together better?
Would Chandramouli go first?
Yeah. Thank you. I was about to say that. I had some radically different views on, particularly on health, because my last 7 years I've been passionate about health, and previously I'd been more in the financial services industry. And I came in with a lot of ideas on what to transform this industry, and soon I realized that a lot more things are far too complicated and different to what that exists in the real world of IT. But one thing I do realize is the cloud has completely democratized computing in many ways, which was not the case before. So the access to technology, to the IBMs of the world and the Tatas of the world, to a startup like what Sugandhi is probably doing, will just be the same. I don't think there is any paucity of availability of technology, high technology. I think we need to make the best use of it. The biggest difference, particularly in health, is as clinicians, as doctors, as hospital providers or service providers, we are sitting on always the next big problem to solve, actually. I think that is what is probably missing for a technology guy who's just looking at it from an outside world to really collaborate. I think the biggest reason, if at all, that we wanted to change anything, particularly on health, is to see a better collaboration of technology and the providers working together. I think that's one. The second thing is, going by the same token, I would definitely put the digital being one of the forefront of today, what we are trying to do. The digital disruption to happen, you need a lot more of innovation and incubation labs and innovation, and where the providers can really sponsor data, sponsor problems for the industry to solve or work together, rather make available the access to the people and the problems that they are working on day to day. That will really help the new guys to really come in and put in an outsider's view of what needs to happen. Because whatever is said and done, I think the health tech is a restricted view of the bigger MNCs type of stuff still pre-COVID times, actually, because it's already opened up the Pandora's box. Because today almost everyone else is really focusing on what needs to do. I think health innovation should be the order of the day, particularly for a provider to really champion and come out with problems for them to solve in their own way. I think these two things can really make it work. I think we have. I think rest of our lives we can keep innovating for the good of the mankind, actually.
Okay. Dr. Sugandhi?
Yeah. So I would look at it in two phases. I think right now, India does not have national level statistics that is respected all over the world. So they always think we underestimate, overestimate, all that, accusations go on. So if we could establish that we are collecting good quality data, and we are able to convince the doctors and the patients that our decisions are based on this good quality data and good analytics on it, I think it will go a long way, because we do not have ethnic related data on either the medicines or the way that we acquire certain, let's say, electrical activity of the heart. We don't have ethnic data on this. So that's one part. The other part is major education is needed. either people are very apprehensive and say they're going to use my data, they're going to do this to me, and all that. So exactly how could one use it? And if it is indeed anonymized data and we do use it for clinical research, how would that give a negative impact to any patient, so that we actually convince them that first of all, they should take part in clinical research. They should be educated enough to understand that without that, medicine can't progress and will be very dependent on other countries. And the doctors also should lose their skepticism and understand that medicine has to progress, and this is what is happening. I still meet an occasional doctor who is not on the net and doesn't have an email address and stuff like that. So that I think would be corrected by education, so that everybody, as you said, 17 articles per day just to keep up with medical research.
Right.
That's a good 80 to 100 pages of reading per day. And so that's what we need to inspire every single doctor to do, that and be up with whatever research is going on. So there should be specialty updates and general updates, so that you can keep the overall patient healthy. And of course, you need to be up with whatever specialty it is. So I think education is my keyword.
Great. Look, I think brilliant thoughts that you both brought in. Thank you for that. And I strongly believe, I think what Mr. Chandramouli said and what you talked about, education is definitely big. Collaboration is definitely a big thing. And I think a country where we have all these things available, partnering with each other with the agility of a startup and the strength of a MNC and eyes of a clinician, and if they are all combined together, I think we can make wonders.
Yes.
With the digital platform that is going to come in the country, I'm definitely convinced that we are on a path where India can take a lead in the strategy for healthcare in the future. And India will also become a country which will empower its patients as consumers and will make a difference in the coming years. Thank you. Thank you for a wonderful discussion.
Thank you. Thank you so much.
Thank you.
Yeah.
Thank you, Dilip, for the keynote, and also thanks a lot for moderating that discussion so beautifully. By the way, full credit to you, Chandra and Dr. Sugandhi, for their insights and for ensuring that we also adhere to the scheduled time slot. Thanks once again.